So today we're talking about tension in your baby. Sometimes that can be misinterpreted as being really strong. We want these babies to be cooked noodle, right? Nice and floppy. We don't want them to be an uncooked noodle where they're really stiff. Sometimes that can be caused usually by the birth process. You know, if we're coming out here and we're yanking on that baby or we're doing a vacuum, just think of that. If people pulled you, then what's going to happen to that fascia, that nervous system is going to go, whoosh. It's going to go like that. It's going to be really in that fight or flight, and all that fascia is going to be really, really tight too. It can be in utero constraint and the positioning in there as well. A lot of times what we see is that birth process and a lot of what we call axial tension. Even in a nice normal birth, that can be an issue as well. And a lot of times what we talk about is that one piece of fascia going from our tongue all the way to our feet. And so if we have some oral restriction, that's going to affect the rest of the body as well. And that's part of our job, is to suss that out for you guys, right? To say like, okay, a lot of those nervous system things can mimic oral dysfunction and oral tension. And so we want to help families kind of work through that and give them homework to do. What I'm going to go through now is just some things you can do at home to say, ooh, okay, that's not strong, that's some tension. Some things that you can say, well, let's maybe get that checked out. So first of all, just when you pick up your baby, it should be nice and loose and floppy, right? If you're handing them over and you're doing this and the baby is nice and stiff, that's definitely tension. Okay. One thing we do is when the baby's on the back, if we can very easily bring that baby's hand above their head, that's good. A lot of times you'll feel like they'll resist you, and that's because that nervous system, that fascial tension, that's tied up into that cervical thoracic, could be like a first rib issue, could be a cervical issue where we're just not comfortable moving that. So if we can't do this nice and easy, that's an issue. One thing we do is squish the baby up through here. There should be nice and loose, right? So this should be not a problem, just like it is right here. We should be able to get the toes to the forehead nice and easy. Obviously, we're never going to force anything. One thing we do is called the accordion test. So your baby's here. We want this the head to be nice and neutral, okay? So if we're going here, we can get that knee somewhere up to the baby's ear. That's really good. And we do that obviously both sides. Sometimes when we see tension, what that looks like is we go to do this and then the baby starts turning, right? We don't have that lateralization, that movement. So we did the arms here. So that's, again, axial tension. This is, side to side tension. If we're doing tummy time, we can see a lot in tummy time. So in tummy time, right, this is kind of something we see, oh, they're picking their head up. This is really good. Not a newborn, right? I mean, there can be some of that. We should be kind of floppy and down. So a lot of times we see is tension here. So if this is really tight, that's going to pull that head back and we're going to be looking up. But we're extending from our kind of mid-back. We're not doing this. And again, even at a few months old, is that really purposeful or is that tension that's creating that, okay? Another thing to look for, if we're on the floor doing tummy time, a lot of times this baby will be up and it'll be turning like this. And then what you'll see is this knee come up. So it won't even be touched to the ground. Baby and tummy times, right, they should sink into the ground, right? Into the floor. And so if we're getting tension here, okay, so the neck is up, and a lot of times it's twisted and rotated, some of that torticollis head preference that we see even in feeding, or just when you're laying the baby on the back that it's turned one way all the time, or in the car seat, you get, every time he's in the car seat, he likes to turn, and that's that fascial pattern, nervous system tension come into play. But on tummy time, we got tension here, that turns, and a lot of times this will go. Now, if it's really, really tight, then what happens is the baby will roll over. I say, oh yeah, we're rolling over already. I'm like, oh no, that's not a great thing. So the baby's knees should be down. They should be sunken into the floor. And so if we're having that tension there, that is not going to be conducive to a nice floppy baby. The issue, right? It's just not you and I having a tight muscle. These babies, they're wearing their nervous system literally throughout their whole body. So we know that a tight baby is going to be less likely to, poop every day. It might have some reflux, it might, colic, constipation, just fussiness, having a hard time, getting through gas and really efforting to poop. So that makes sense, right? If you're all twisted up and you're tight, things aren't just going to flow through. They're not going to go through here and just kind of process through. They're going to come up, or they're going to have a hard time going all the way through. So this is what we check this. The things that we just did, we do all day, every day with babies. And this is kind of our pre and post check every adjustment to see, make sure that we hand baby back to the parents that it's nice and floppy. And then we're going to give you home instructions to look at that and to do things at home as well. So tension versus strong, a lot of times it's just tension. And if some of these things that we go through that you're seeing, reach out. Let's get a conversation going and see how we can help.